Hello. With novel therapies, the number of cancer survivors is improving across the United States. As more older individuals are entering cancer treatment, the chances that they have already been dealing with other physical illnesses is high. They may not be at their physical best. And then treatment itself, chemotherapy, radiation, or surgery can take a toll on a person's physical ability to function. And then research shows that structured exercise programs can help at all stages of cancer survivorship. But these physical deficits can get in the way of achieving these recommended levels. For example, pain may limit walking, muscle weakness or neuropathy may cause balance problems and falls, or just lack of movement or range of motion can limit function. And this is where rehabilitation therapists can help bridge the gap. So physical therapists are trained to evaluate these impairments. They understand how these impairments affect function, and then they can treat these impairments to help return to more normal function or maximize function. And this can make a big impact on how an individual comes out at the other end of their cancer treatment journey. I'm Archana Kanetkar. I'm a physical therapist. And my role within rehabilitation services with IU Health has allowed me over the last 2 years to be part of a team that works with patients at the IU Simon Comprehensive Cancer Center. And it's my pleasure to introduce our expert panel today. Jennie Brouillette and Bryce Showers are both physical therapists and PORI-Certified Oncology Rehab therapists. So a little bit about this PORI certification. So the Specialized Physiological Oncology Rehabilitation Institute, or for short, PORI certification, is a key credential for oncology-focused rehabilitation therapists. In 2020, in the whole state of Indiana, there was only one therapist that had this certification. And through an IU Health Foundation donor's vision and support of what this specialized therapy could mean to others, I am pleased to share that today there are 9 rehabilitation therapists, physical therapists, as well as occupational therapists who have received the PORI certification. We are grateful to the donor for this investment in IU Health because it benefits the patients throughout the continuum of their care. Jennie Brouillette has spent majority of her career treating patients with multiple cancer diagnoses. Through PORI, she has received additional training in rehabilitation of head and neck cancers, as well as exercise and chemotoxicity. She's an adjunct faculty at IU, as well as University of Indianapolis PT schools, where she teaches PT in oncology. Jennie is an inpatient physical therapist, which means that she works with patients with cancer when they have to be admitted to the hospital, either for surgery or transplant or chemotherapy. Bryce Showers, besides being a certified oncology therapist, he also has received additional training in chemotoxicity and exercise. As an outpatient physical therapist with a focus on breast cancer, his primary area of practice includes working with those patients who are beginning their cancer treatment, which means optimization of their physical functioning, which is called rehabilitation, or if they are experiencing specific deficits that need an expertise of a physical therapist in order to return to normal function. Bryce also works with other therapists across the nation to develop tools, outcome measures that are specifically would be helpful to patients with cancer. Bryce and Jennie have information for us to explain the role of a physical therapist with this population. And after that, we will also be able to answer some of our questions. With that, I'd like to turn it over to Bryce.
Thank you, Archana, for this introduction, and good afternoon, everybody. What I'd like to do here is Archana provided us a nice description about what we're going to get into, but we wanted to put a brief outline slide for some context. So what we're going to talk about today, we'll look at the purpose of physical therapy for cancer survivors. Then we'll take a look at where you may encounter physical therapy or rehab services throughout your cancer journey. Then we'll look at the importance and the impact of physical therapy and rehab services when you're living with and beyond cancer. And lastly, we'll discuss a few common symptoms that we as physical therapists may address in each of our settings.
Okay, thank you, Bryce. So to speak a bit more about the purpose of rehabilitation therapies. So our goal is always to optimize function and reduce disability in patients with cancer. So we do this by diagnosing and treating physical and cognitive problems, sometimes with the help of our colleagues in occupational therapy and speech therapy. We aim to lessen the side effects of treatment. So a good example would be chemotherapy. That's a whole body treatment. It affects all body systems. So sometimes those side effects could present like decreased balance if the nervous system is affected, shortness of breath if the lung system has been affected, decreased endurance if the cardiovascular or the heart system has been affected, etc. So we strive to maintain and improve movement. So let's say for a patient with head and neck cancer, maybe breast cancer who's had surgery or radiation that might cause some tissue fibrosis or scarring, we can get in there with some manual tissue work, some mobility techniques to try and get that range of motion improved in the neck and shoulder. And then hopefully that leads to maximizing independence with activities. So once that neck moves a little better, the shoulder moves better, it's easier to get on and off a shirt. Maybe for a patient that has an abdominal incision, once that abdominal incision can tolerate being fully upright, and we can get some core strengthening back, it's easier to get in and out of bed or up a flight of stairs. We can reduce the severity of cancer-related fatigue. So we'll talk more specifically about cancer-related fatigue in a few slides. Basically, it's fatigue that's persistent, it's debilitating, it affects a large majority of patients with cancer. So we can actually help to reduce the severity of that. Physical therapy has also been shown to reduce the risk of cancer progressing or even coming back in some situations. And so ultimately, by minimizing side effects and reducing disability, and by improving movement and independence with activity, we can help provide an overall improved quality of life for our patients.
So as we begin, we're going to talk about the phases of oncology rehab. And specifically, we're going to touch on these 4 phases here and where you may encounter physical therapy services every step of your way along the journey. So the initial phase, which Archana also referred to as prehabilitation or the preventative phase, this is a period following initial diagnosis, but before any oncology treatment begins. At this time, we can identify risk of impairments based on planned treatment and interventions, which can help us then minimize and prevent early onset of side effects. The next phase is what we call the restorative phase. This may be what you commonly think of when you hear physical therapy. So during this phase, the emphasis is returning you to your prior level of function with the goal of little or no residual dysfunction following treatment. The next phase is the supportive phase. This is a phase of persistent impairment and disability that's anticipated following treatment. The main emphasis here is to maintain the current state of function and well-being and reduce the risk of any further decline. The palliative phase, this is a phase of advanced disease and chronic symptoms. So when an individual may be enrolled in hospice services, physical therapy services can again intervene to maximize function and overall quality of life. So now we'll move into living with and beyond cancer. So when we think of chronic diseases, we tend to think of conditions like heart disease, kidney disease, diabetes. Many of these individuals live with these conditions and their side effects and receive occasional treatment throughout their journey. More recently, we've come to understand that cancer is more of a chronic condition. While we may have surgery to remove a tumor, or we may undergo chemotherapy and radiation that's curative, the side effects from those treatments we are finding are more long-term. And this is super important when it comes to caring for patients with and beyond their cancer treatment. What we've also learned, and this is great based on our knowledge and advances of medical diagnosis and treatment, is that the 5-year survival rate has actually improved to nearly 70%. This means that more people are surviving longer after their cancer treatments. So this is just fantastic news, but we want to make sure that we're identifying and addressing those impairments that come with the chronic side effects of treatments so that survivors are able to get back to work, play with their kids or their grandkids, and enjoy returning to the activities that they enjoy most. And this is where physical therapy and rehabilitation services is imperative and very effective at helping patients remain active and functional through treatment.
So for the next 2 slides, we're going to discuss that articles demonstrate that cancer survivors' physical and emotional problems often go untreated. So what we've come to learn from these studies and several others is that a very high number of patients are reporting physical and functional impairments that are occurring following their cancer treatments. But unfortunately, despite having these impairments, only about 1/3 of these patients are receiving rehab care. So this first study found that despite 92% of participants reported having physical impairments, only about 1/3 of them received rehabilitation care. Another study found that for the 10 most common types of cancers, 63 or 2/3 of those survivors reported the need for rehab services. Evidence also suggests that physical disability is likely the leading cause of emotional distress in survivors. So this just shows that we have great room to make meaningful and impactful changes on the quality of life of cancer survivors.
So now we're going to take a closer look at how therapy services can help you improve your overall quality of life. So we have a few common areas of impairments listed here, and we're going to take the next couple slides to go through them. And what we're going to do is, because of Jennie and I representing different therapy settings, Jennie inpatient, where you may find her in a hospital setting at your bedside. Myself being more in a traditional outpatient clinic, we'll touch briefly on how our treatments may vary between them. So we have listed areas like falls, pain, range of motion, shortness of breath, and chemo brain, and we'll expand on these as we go forward. Also for clarification, I want to address lymphedema and pelvic care as specialty areas. And for a little context, lymphedema is the presence of swelling that is caused when fluid in tissues is unable to be returned to our circulatory system, which leads to swelling of a limb or limbs. Pelvic floor therapy is a specialized area of rehab services that targets muscles of the pelvic girdle to address impairments of incontinence, pelvic pain, and sexual dysfunction.
So to address these impairments one by one, so starting with falls, there are many reasons why a person may be at increased risk of falling while in the hospital, being in an unfamiliar environment, being attached to a lot of lines and tubes, different medications, and so forth. Physical therapists can provide a training for assisted device use. So we can provide either a walker or a cane to help improve the stability of a cancer survivor while they're here. We can also provide balance and strength training if that's the underlying issue for the unsteadiness. We can educate on risk factors, like sometimes blood pressure can drop when a patient goes from lying down to sitting up, and put them at increased risk of falls, or the fact that medications can also make patients unsteady or off balance. We can also provide family training on how to assist the patient with mobility at home and how to make the home environment more safe for that patient.
In the outpatient setting, we can work to identify factors that contribute to loss of balance and falls, and then progressively challenge these areas of impairments to then reduce this risk. We also build and core and lower extremity strengthening programs to improve stability during functional movements. Also utilize known side effects of medications to monitor and identify early signs of unsteadiness to further reduce progression that could lead to falls down the road.
And so for pain, in the hospital, physical therapists can help address pain by encouraging increased activity with periods of decreased pain. So oftentimes in a hospital, physical therapy is trying to time our sessions after you've received pain medications when possible. We can also provide hot or cold therapy to help minimize pain or spasming. And we can also use external methods of minimizing pain, like the use of an abdominal binder, which is basically a big elastic corset that can kind of help keep abdominal incisions more still, or use of a arm or a pillow to help keep a thoracic incision more still so the patient doesn't hurt as much while they're moving.
Once in the outpatient setting, pain is often addressed through an exercise prescription, but we also have techniques like manual therapies, such as joint mobilization and soft tissue techniques, as well as modalities like electrical stimulation, ice, heat, and the use of pain neuroscience education, which can help patients better understand and cope with their pain.
For range of motion, in the hospital, range of motion needs are usually due to a post-surgical situation. So we're somewhat limited in what we can do by the restrictions set by the surgeon after the surgery. But we can definitely provide a range of motion exercise program immediately after surgery for gentle guided return to full range of motion. And also I do a lot of education for my patients of when they should pursue more formal outpatient physical therapy to regain their full range of motion once they're cleared by their surgeon.
Then as you transition to me, likely your surgical incisions are well healed and our focus shifts to ensuring that we have the tissue mobility to regain our functional motion. PTs then can use, again, manual scar mobilization techniques, joint mobilizations, passive and active range of motion, and then progressive strengthening to help us regain that full motion and achieve our goals.
And then for shortness of breath, so we can teach techniques like how to position yourself in bed or in a chair to minimize shortness of breath. We give specific breathing exercises to encourage deep breathing. We provide endurance training via walking programs or activity recommendations. And we also encourage the use of an incentive spirometer. So that's a plastic device that we can provide that will help you breathe more fully and deeply.
In the outpatient setting, we're going to continue to emphasize the breathing exercise and postural education. More so, we're going to use measures of activity tolerance and endurance, such as walking tests or treadmill tests, which then we'll use findings from these to provide specific exercise guidelines for each individual in order to gradually improve their ability to endure tasks. We may also use manual techniques if there's restrictions in rib expansion that could reduce our efficiency.
So moving on to lymphedema. As Bryce mentioned earlier, this is a specialized area of physical therapy. So physical therapists can provide tailored treatment for patients with lymphedema, both in the hospital and in an outpatient setting. It's a very manageable condition. We can provide manual techniques and wrapping to help minimize the swelling, as well as maybe fit the patient with garments to help keep the swelling under control.
Pelvic, similar to lymphedema, pelvic floor care is provided specifically by trained individuals that are either physical or occupational therapists. So if the pelvic region is identified as being affected by radiation, chemo, or surgery, then it's appropriate referral will be made to these individuals. These therapists can use muscle re-education techniques and equipment to help patients regain control of their muscles in the pelvic girdle, which can help improve bowel and bladder control and function. Techniques can also be used to reduce muscle tension, reduce pain in the pelvic region, and improve sexual function.
And then finally for chemo brain, so physical therapy can help clear this chemo brain or brain fog just by simply encouraging moving. So getting the patient out of their room, providing a different environment and different challenges to navigate while moving. We can also refer to colleagues in occupational therapy, speech therapy, neuropsychology for cognitive rehabilitation if appropriate. And then here at University Hospital, we can refer to what's called complete life services. So they offer different services like music therapy, art therapy, yoga, massage, that can all give patients different avenues to engage their brains in different ways. So now I'm going to speak a bit more about that cancer-related fatigue that I mentioned earlier. So it's actually defined as a distressing and persistent subjective sense of physical, emotional, and cognitive tiredness or exhaustion related to cancer or cancer treatment that's not proportional to recent activity and interferes with usual functioning. So again, this is a persistent and distressing tiredness or fatigue that interferes with activities of daily living. So this can look like many different things and present in many different ways. It can look like a feeling of tiredness, weakness, or a lack of energy, an increased need for rest or difficulty sleeping, arm and leg heaviness, pain, maybe diminished ability to concentrate, perceived memory problems, decreased interest in activities, and so on. So it's estimated that 80 to 100% of people with cancer experience this kind of fatigue. And it's also estimated that 33% of disease-free survivors report more than 2 weeks of fatigue per month. So again, a third of our disease-free survivors are reporting this fatigue more than half of the time. So it's thought that this is caused by chronic inflammation. So once that immune response to cancer has been turned on, it cannot easily be turned off. So how can we help? So we can do that by promoting good sleep habits, good sleep hygiene, so educating to minimize disturbances, sticking to a good sleep schedule, and encouraging daily physical activity, which we know promotes good sleep. We can help by reducing stress, so relieving muscle tension with stretching or manual therapy, and also teaching breathing techniques and mindfulness. We can provide education and energy conservation, so maximizing periods during the day when you feel your best, prioritizing activities, pacing activities to avoid overexertion, and also referring to occupational therapy as they're kind of the experts in this education. And then we promote this cancer-related fatigue minimization via moderate physical activity. So we know that that can help mitigate this fatigue, but we also know that high intensity fatigue can actually increase the inflammation. So we use this rate of perceived exertion scale that you see on the slide, or an RPE, to kind of make sure that we're staying within that moderate physical activity. We know that vital signs, so respiratory rate, heart rate, blood pressure, are not super accurate when a patient's undergoing active treatment for cancer. So we use this scale to make sure that we stay within that target range and we're not overexerting our patients.
Now we'll expand on another common side effect. So we're going to take a closer look at what we call chemotherapy-induced peripheral neuropathy, or CIPN for short. So this is a very common side effects of multiple chemotherapy medications.
So talking about chemotherapy-induced peripheral neuropathy, so this describes the damage to nerve cells experienced by a patient who's received a chemo drug that's known to be toxic to the nervous system. So it's a very common side effect to multiple chemotherapy medications. Affects about a third to a half of all patients undergoing chemotherapy treatment. This occurs when the specific medication being received starts to cause damage to the nerve cells. So it's very much like the peripheral neuropathy that you may have heard of before with diabetes and so forth. And it tends to appear in a stocking and glove pattern, meaning the hands and feet are often the first signs of symptoms. Interestingly, the onset of peripheral neuropathy is the most common reason for patients to stop or reduce their chemotherapy treatments. So minimizing its effects can be very beneficial for progressing care.
Apologize for the brief interruption. So to expand on CIPN and how we can help. So what you may notice as symptoms, well, first I want to recognize that these symptoms may begin during treatment, immediately after, or even may come on much later in treatment, what we refer to as late effects. So regardless of when they occur, you may feel a sense of sharp shooting pain, numbness, burning pain, muscle cramps, or notice changes in balance or walking. And you may also notice difficulties in performing small tasks like picking up items or fastening buttons. Again, early identification here is key and helpful to reduce further progression that can impact function. So we can utilize sensory integration techniques, balance training to reduce the risk of falls, and specific types of modalities like electrical stimulation and TENS to reduce the pain and progression. Most importantly, is prescription of an appropriate exercise program.
Using the knowledge that we've shared previously about how therapy services can be helpful, we're going to expand slightly into how we could gear our treatment for certain types of oncology diagnoses. So please keep in mind that this is not an exhaustive list, and by no means the only services that could help get you back to yourself, but simply a glimpse into what treatment may entail from our perspectives. So first up, lung cancer. So early on, our focus would be on posture retraining, so avoiding a rounded forward posture to maximize chest wall expansion, get that shoulders back and relaxed. Teach sternal precautions if applicable. So sometimes patients who have had surgery require an incision through the breastbone that requires special mobility techniques to get in and out of bed and to stand. Education and breathing techniques to maximize full, deep breaths. And then once healing is a little bit more progressed, the focus would switch to stretching and strengthening to maximize mobility in the chest and back. And also we can provide monitored aerobic training to maximize endurance and restore lung capacity. For hematologic or blood cancers, the main focus for these patients while undergoing treatment is prevention of the loss of muscle strength and endurance. So we do this by providing exercise programs for strengthening, walking programs, or a bike to work on endurance. And this should be progressed in intensity as needed. Once the patient is home via aerobic retraining and a progression to more targeted strengthening in order to restore that endurance. We can also address peripheral neuropathy via the techniques mentioned earlier and work on balance impairments as needed. For head and neck cancer, so the initial focus again for these patients is usually post-surgical. So we're working on strengthening, range of motion to the neck and shoulder as allowed by post-surgical restrictions. Mobility training, so oftentimes for cancer surgery like this, another tissue site has to be harvested to help with the reconstruction surgery. So sometimes that might require gait training if a piece of the leg has been used, etc., to restore functional movement. And then once healed, we can be more aggressive with stretching and strengthening to restore full range of motion and function to the neck and shoulder so that you can look over your shoulder to drive, reach overhead to put away dishes, etc. This also might include balance retraining if the vestibular balance system in your inner ear has been affected.
The last three areas we're going to address here are gastrointestinal cancers, genitourinary cancers, and breast cancer. So gastrointestinal cancers, initially following surgery, the treatment, the importance is maintaining movement and endurance on proper bed mobility and functional movements while protecting the incision. We can also begin to use pain management techniques and then work progressively into abdominal strengthening and lumbar stabilization training. In these instances, and based on the treatment regimen that's prescribed, pelvic floor muscle reeducation and training may also be helpful to address impairments. In genitourinary cancers, here the pelvic floor specialist can use muscle reeducation again and manual therapy techniques. If fibrosis management is needed, they can also provide behavioral modification and biofeedback mechanisms for incontinence management. Based on the treatment prescribed, PTs can also help reduce pain and address any potential impairments in strength and range of motion of the lower extremities that may be directly affected by treatment. Systemically, patients could develop neuropathy or CIPN like we talked about above and would benefit from those types of treatments. Breast cancer, treatments for breast cancers, like all others, vary greatly from single treatment plans with just medications to patients receiving chemotherapy, radiation, and surgery interventions. If surgery is a treatment method, then therapists will work to maintain and improve tissue mobility so that restrictions are not limiting range of motion and function of the upper extremities. Depending on the surgery that's performed, certain chest muscles may be involved, which can impact posture and upper extremity function as well. Here, a progressive strengthening program will likely be appropriate to retrain strength, retrain muscles and regain strength that's lost during treatment. Similar to other chemotherapy regimens, the medications here cause joint pains, fatigue, neuropathy, and even affect muscles of the heart. So testing and prescribing patient-specific exercise programs and using vital RPE scale Jennie referenced above are very helpful in stabilizing side effects and improving overall function and quality of life. With the last slide here, what I'd like to do is just spend a little bit of time talking about what's currently going on through the lens of physical therapy at the IU Simon Comprehensive Cancer Center. So one current initiative is what we call our MOVE program, the Multidisciplinary Oncologic Vitality and Exercise Program. This is built in under what we call supportive oncology, which includes physical therapy as well as other disciplines. And what we're trying to emphasize is the importance of exercise and functional mobility throughout the care continuum. And specifically for PT, we're trying to generate clear pathways to rehab services. As part of this program, we're also providing and sharing knowledge of community resources such as yoga, massage, acupuncture, resources that can be helpful in managing these side effects that we addressed above. As part of this program, we're also collecting data in an effort to generate research on the effectiveness of our treatment interventions and how that impacts patient outcomes over time. In the long term, to use some of this information to track healthcare utilization and how that can potentially reduce costs for patients. As Archana referenced initially, I'm also collaborating with oncology rehab experts throughout the country using the American Physical Therapy Association, or a national organization, to develop oncology-specific balance and fall screening tools. While there are validated screening tools used for falls, none of these tools are specifically geared towards the oncology population, which would be very helpful to reduce risk and identify it. Lastly, I'll talk about the Prehabilitation program for patients with pancreatic cancer, which is also an initiative here at Simon and University Hospital. So this is a prospective surveillance model, which involves preoperative assessment and treatment to establish a patient baseline, immediate postoperative assessment and treatment to determine any immediate effects, and followed by periodic ongoing surveillance in order to identify any new onset of functional impairments and treat immediately. This allows for timely intervention to reduce further decline or facilitate a return to the highest functional level as early as possible.
Thank you, Bryce and Jennie. From the information that you have provided, it is evident that when it comes to physical functioning, whether a problem is small or significant, or at any point during treatment, it may be a valuable thing to get physical therapy or rehabilitation therapy assessment done. We have received a few questions in advance that we will tackle next. I want to thank everyone for their patience while we work through a little bit of our technical difficulties. This first question, I would like to address, I would like Bryce to address. The question asks, how do I recover my strength and agility following treatment for prostate cancer, which included 9 weeks of radiation and 15 months of hormone therapy? And another question had a similar problem, so I want to add that, dealing with loss of muscle and strength. How do you do that? Bryce?
Sure. Thank you, Archana. And thank you. So most importantly, we want to make sure that there's no side effects from your prescribed treatment that would place you at greater risk of injury. Sometimes hormone therapies that can be used for prostate cancer can lead to osteoporosis or bone loss. So medically, we want to make sure that we're cleared and appropriate for exercise. If so, then we can begin developing a progressive strengthening program. And that would also lead into your second question, of that would be one way to the loss of muscle mass is a progressive individualized strengthening program. Also, if at this point your functional needs are met and you are where you need to be from a work and a life standpoint, important for physical therapists to then appropriately hand off to trained exercise professionals to continue that progression to regain the strength that you need.
So it would be a very customized approach where you would really be able to evaluate specifically what's going on and then make recommendations. Okay. My next question is for Jennie. How does performance status of a patient affect physical therapy?
It's a great question. So we are always taking current level of function, prior level of function into consideration when we evaluate and set an exercise prescription for our patients. If we have a patient that's maybe at a little lower of physical mobility at this moment because of other conditions or illness or what have you, we would definitely tailor our exercise prescription to that by reducing the frequency, the duration, maybe lessening the intensity or the kind of exercise. So that way we make sure that we don't overexert or even harm our patients. So from there, we could build a good foundation and then advance the exercise program as the patient's able to tolerate.
Okay, yeah. And the next question, I feel like we may have, you may have alluded to, but maybe expand a little bit more. Can you comment on recommendations of physical activity outside of physical therapy? So if someone has completed their course of physical therapy and then they want to move to doing it on their own. Bryce, can you answer that one?
Sure, absolutely. And that would is a fantastic question. I would challenge you to first look up or go through the YouTube channel or look on the Simon website. Look up the lecture by Dr. Tara Bollinger or Melissa Sherman titled Get a Move on Cancer. They do a great job discussing the impacts of physical activity throughout the cancer care continuum. I also want to emphasize that exercise before, during, and after treatment is imperative for maintaining and improving function, as we touched on. The American College of Sports Medicine performed extensive research over the past couple of years to address this specific question. And they've created guidelines of 30 minutes of exercise 3 times a day of aerobic exercise, and then 2 days a week of what we call resistance training or strength training. While this is a great guideline, it's also important that you work closely with a physical therapist or exercise trainer because of the treatment that you received or may require personalized approaches.
Right, thank you. The next question, this would be for Jennie. Can physical therapy help long-term radiation-induced neuropathy? Having had radiation treatment for testicular cancer in 1985, then cured at IU in 1986, this person has limbs and back issues, which the physician suspects may have been caused by radiation. Jennie?
Yeah, that's a great question too. So this would fall more into one of those beginning slides. Bryce mentioned the roles of physical therapy throughout the continuum of cancer care. So that would be kind of in the supportive role. So it's possible that there's still some residual tissue or nerve damage from that radiation therapy long ago that we maybe can't undo, but we definitely can maximize the function of the structures and tissues that you still have left. So I think if there's some limping involved, I heard that could be gait training or using some strengthening to strengthen some muscle groups that might be weaker. We could also provide, like I said, like a walker or a cane to help with mobility and walking training, providing bracing if that's appropriate for this patient. There's lots of things that we could try to help get that walking look a little prettier. And then back issues. So all the things that Bryce has mentioned for outpatients. So manual therapy, soft tissue mobilization, strengthening, all those things could be utilized to hopefully get the back functioning a little bit better and hopefully end up pain less or pain-free as possible. So yeah, we can definitely still treat impairments even that old.
Yeah, so a physical therapy consult actually would be a really good idea.
I agree.
For this. Bryce, does physical therapy also specifically affect kids who are cancer survivors?
Yes. So again, pediatric physical therapy, much like in the medical world, and like lymphedema, is a specialized area of PT. But the common side effects we touched on from chemotherapy and surgery and radiation do apply to the pediatric population. It's important that we intervene there and identify those impairments and begin treating them early to reduce any long-term side effects.
Yeah, I know. I mean, it may be different activities that kids may need to return to. So again, it would just need to be customized for what they need. We received a question through the chat, and I'm going to ask Bryce this question. When should someone contact physical therapy? At diagnosis or after treatment?
Yeah, so this is great. So like I touched on that last slide, there's currently a big push with what we're trying to do rehabilitation. So I would argue that at diagnosis may be the best time. We know your treatment plan potentially through your medical notes, and we can assess areas that could be affected down the road. But then unlike traditional PT where we would maybe see you once or twice or 3 times a week, if we see you pre-rehabilitation, we would just check in monthly over time to monitor for any impairments. But also, if you've already begun treatment, it would be beneficial to get an assessment now. We can work to address any impairments that may have already shown up, or again, provide you with exercise to help you overcome some of the side effects that we talked about today.
So it is kind of like charging up your phone fully before you're going out on a trip. So being in the best possible physical shape before. So beginning of treatment would make a lot of sense. Another question I would like to direct to Jennie. Does a head and neck radiation treatment continue to damage tissue or muscles much after the treatment?
So it's possible for the tissue to still be affected more and more after radiation has occurred. That's kind of a cumulative process, so we know that the damage can accumulate over time. So it is possible for it to continue to damage treatment or damage tissue after the treatment, but generally after radiation is done, after surgery is done, we're kind of left with what we have, and then we can start the work there. And this is also a good tie into the last question also. So there are some conditions like fibrosis or scarring that can happen after surgery and after radiation. Lymphedema would be another one where earlier intervention is better. So there's some phases of remodeling where the tissue goes from injury to healing, that it's really best if we can get in there as early as possible to make the biggest change.
Okay. Trying to see if there are any more new questions. We had another question that we had received. Why are we not advocating to push for early screening for any cancers to avoid all of this? And I would have to agree 100%. Early screening and prevention is one of our best tools. And actually, IU Simon Comprehensive Cancer Center, we actually have multiple cancer prevention education programs, targeted screenings, for breast cancer and colon cancers. There's like a targeted communication to patients, encouraging screening, interactive educational webinars. And I know that there are plans in the works to expand this to head and neck cancers as well. I think we currently do them for breast and colon, but I agree that should definitely be the #1 way to avoid all of this. So if there are no more other questions, we can conclude our session today. Thank you all for listening and also sending in questions. If there are more that you think of, our contact information has been provided, and we would be happy to answer your questions. Bryce as well as Jennie bring a ton of expertise, and so they would be able to answer or direct your questions. Thank you, and have a good afternoon.